Have you ever wondered why two nurses can assess the same patient, yet one recognizes that something is wrong before anyone else does? The answer is not luck, nor is it experience alone. It is the ability to identify early warning signs that others may overlook. Welcome back to Think Like a Nurse, the podcast dedicated to developing critical thinking, strengthening clinical judgment, and promoting safe, evidence-informed patient care. Hi, my name is Love, and today we're beginning a very important series called The 7 Red Flags Every Nurse Should Never Ignore. So red flag #1, difficulty breathing or low oxygen saturation. If you've listened to previous episodes, you've probably heard me say this before. Airway comes first. Without adequate oxygen, every organ in the body begins to suffer. The brain is affected, the heart is affected, the kidneys are affected. One of the biggest mistakes new nurses make is waiting for obvious respiratory distress before taking action. But experienced nurses know that deterioration often begins with early warning signs.
Those signs may include increased respiratory rate, new shortness of breath,
changes in skin color, such as pallor or cyanosis, sometimes the patient tells you before they do.
Example, Mr. Ade with pneumonia. Imagine you're working a morning shift on a medical ward. Your patient is Mr. Ade, age 65, admitted with pneumonia. 8 a.m., his assessment looked reassuring. Oxygen saturation, 96% on room air. Respiratory rate, 18 breaths per minute. At 10 a.m., you return to reassess the patient. Immediately, you notice several differences. He's sitting upright in bed. His breathing is noticeably faster. Muscles in his neck work with each breath. You ask how he's feeling. He pauses and says, "I can't seem to catch my breath."
This is the moment where nursing judgment matters.
A beginner might think, maybe he's just anxious, but anxiety does not explain all the findings together. Let's analyze the clues. His oxygen saturation has dropped significantly. Respiratory effort has increased. He's using accessory muscles. He reports shortness of breath. His position in bed has changed. Notice something important. You do not wait until the patient becomes unconscious. Early recognition is what prevents emergencies. Whenever you assess breathing, don't focus only on the monitor. Look at the patient. Are they speaking comfortably? Can they finish a sentence? Are they using accessory muscles? What is the respiratory rate? Is the skin pale, sweaty, or bluish? Do you hear wheezing, crackles, or diminished breath sounds? Monitors provide data. Patients provide the full picture. Now let's move to another warning sign that can be just as dangerous, even when the patient is breathing normally. Red flag #2, sudden change in mental status. A sudden change in mental status is one of the most underestimated warning signs in healthcare. This can be caused by low oxygen levels, low blood sugar, infection, medication effects, stroke, electrolyte imbalance, sepsis, dehydration, many other serious conditions. The key word is sudden. Nurses must pay attention to changes from the patient's baseline. Let's meet Mrs. Okafor, age 74. She was admitted yesterday with a urinary tract infection. During your morning assessment, she was alert and oriented, chatting with her daughter, able to state her name, location, and the date, calm and cooperative. Later that afternoon, you return. Something feels different immediately. She looks frightened. She doesn't recognize you. She asks why she's in someone else's house. Then she tries to climb out of bed. Some people might say, she's elderly, maybe she's just confused. Earlier today, she was oriented. Now she is disoriented and frightened. That change is the red flag. When mental status changes suddenly, your nursing response should include assess vital signs, check oxygen saturation, consider blood glucose if appropriate, review recent medications, perform a focused neurological assessment, ensure patient safety. Report significant findings promptly according to protocol. One habit that strengthens clinical judgment is asking 3 simple questions whenever a patient's condition changes. What has changed? Why might it have changed? What should I assess next? Those 3 questions help move you from panic to organized clinical reasoning. Let's review what we've covered today. Red flag #1, difficulty breathing or low oxygen saturation. Watch for increased respiratory rate, accessory muscle use, oxygen saturation. Remember, treat the patient, not just the monitor. Red flag #2, sudden change in mental status. Watch for new confusion, disorientation, unusual sleepiness, agitation, behavior that is different from the patient's baseline. Remember, confusion is a symptom, not a diagnosis. Your job is to investigate the cause. In the next episode, we'll continue the series with red flag #3, chest pain, and red flag #4, using realistic hospital scenarios to strengthen your clinical reasoning even further. Until then, keep observing carefully, keep asking what has changed, and keep thinking like a nurse. Thanks for listening.